Today, talking with you about transfusion. So yes, I'm a hematologist and as hematologist, we do a lot of transfusions. You might do too. And it's important for us to understand what happens with transfusion of our patients. And I just want to shed some light on some things that I think might be important for you to know. And so we'll talk about transfusion. And today specifically, we're going to talk about what modifications happen with red blood cells that are being transfused, or really blood products in general. What modifications are important? Because sometimes I'll have my fellows or my residents ask me, so when do I do radiation versus non-radiated? When do I wash red cells versus non-washed? I'm going to demystify all of that for you in today's episode. Okay, let's start first with leukoreduction. Okay, leukoreduced red cells transfusion. So in general, all blood products are leukoreduced. We leukoreduce blood products because we really want to decrease the risk of a febrile reaction. So many times white blood cells are in the product and they release cytokines, and they also can be harbingers of infection, including CMV. For that reason, most red blood cell products, especially in the United States, are actually leukoreduced. And that you do in patients, especially who have a history of febrile transfusion reaction, and in patients for whom you're concerned about CMV infection. And so in general, what we really have is universal leukoreduction of products. We tend not to see the febrile reactions as much anymore. We tend not to see CMV transmission. So leukoreduction is pretty much going to be done on any blood products that you are transfusing. Now, how do we do the leukoreduction? We get a leukoreduction filter, and we pretty much filtering the product to filter out the leukocytes. That's what we're doing. So it's really kind of like, in a sense, a manual leukoreduction, passing the blood through the filter. Okay, that's leukoreduction. How about irradiation? When would you want to irradiate the products that you're transfusing? All right. So leukoreduction gets rid of a lot of white cells. What it doesn't do is get rid of plasma cells. And the reason you want to irradiate the cells when you want to kill plasma cells. And so plasma cells can cause a transfusion-associated graft versus host disease in patients who are susceptible, as in patients who are immunocompromised, in patients who are undergoing transplant, usually hematopoietic stem cell transplant. And so in every patient who either has a history of stem cell transplant or is a potential candidate for stem cell transplant, you mostly want to irradiate the products. And that's because you want to avoid the potential for a transfusion-associated graft versus host disease. And what do we do with the radiation? It's exactly what it sounds like. The product is exposed to radiation and it kills the plasma cells. And that really, really, really decreases the risk of transfusion-associated graft versus host disease. All right, what else could we do with blood products? Well, another thing that we do is we wash products. And sometimes this is really referring to red blood cells. We wash red blood cell products. And red blood cell products are washed. That means you kind of take off the plasma from them. You suspend them in saline. And so you're removing the plasma. We do this in patients who have had allergic reactions. And so in patients who've had allergic reactions like hives, especially that are not responsive to antihistamines, so if the patient continues to have allergic reactions, then you might want to wash the red blood cells. And that's essentially suspending the red blood cells in saline to prevent the possibility of allergic or anaphylactic reactions. All right, those are the three major modifications. So we can wash red cells, we can leukoreduce cells, and we can irradiate them as well. So those are the big three that we tend to do. There are other modifications, but these are the major ones to consider. And I think people get stuck mostly with irradiation. Who gets irradiated products? Who doesn't? So most people get leukoreduced products because now we have defaulted in the United States to universal leukoreduction. Irradiated products go to people who are immunocompromised. Neonates will get irradiated products as well, or patients who are undergoing stem cell transplant. Either they are post-stem cell transplant or they're on their way to stem cell transplant, so they're likely immunocompromised. And then we will also wash red cells where there have been allergic reactions. All right, those are the three modifications I wanted to talk to you about today. Thank you for listening. I will talk to you next time.